Hi, I'm Dr. Jacob Zide, and I'm an orthopedic foot and ankle surgeon with Baylor, Scott & White. I also serve as the program director of the Foot and Ankle Fellowship at Baylor University Medical Center here in Dallas, Texas. Our fellowship was established in 1991 by Dr. Jim Brodsky, and since its inception, more than 100 clinical and research fellows have come here to hone their skills and build lifelong friendships. Many people wonder about the differences in education levels when meeting someone pursuing medical training. An orthopedic fellow is someone who has completed their residency training and possesses the capability to go out and practice surgery on their own. At Baylor Scott & White, our fellows choose to pursue an additional year of subspecialty training in orthopedic foot and ankle surgery so that they can deepen their knowledge in the area of orthopedics that they find most interesting. Having a fellow in the clinic and operating room is a major benefit to our patients. Like I said, fellows are already fully trained orthopedic surgeons, so if you're lucky enough to have one see you, it's like you're getting two medical opinions at the same time. During your visit, faculty and fellows discuss the nuances of each individual patient's problem, and we work together to make recommendations on what we feel will be the best course of action to get you better as quickly as possible. Now let's hear from some of our faculty surgeons on their fellowship experience.
I started the fellowship because foot and ankle surgery was new then, and it was a new subspecialty of orthopedics. And I thought there was a lot of room to teach and to research and to advance the field. And that's what the program has done. Over the years, we've trained well over 100 fellows. They're spread out all over the United States and all over the world. We have them on pretty much every continent except Antarctica. But I don't think there's any good clinics there.
So as a young resident, I was a resident in Pennsylvania. My first time to Texas was actually when I interviewed for this fellowship program. So it actually surprised me how much I really enjoyed my interview. I felt that there was a depth of knowledge and personalities that I could learn from. I also felt just in that short interview process that these people would care about me, not just as a number, not just as a surgeon, but developing me as a person. Honestly, it just felt like home. It felt like a group of people who are going to take care of their fellows, teach them how to be good surgeons and great clinicians. So during the fellowship here, you spend an ample amount of time both in the clinic and in the OR. And I remember early on, Dr. Brodsky said, I'm going to teach you not only how to be a good surgeon, but to be a good clinician, and that they're not the same. When he said that, all of a sudden it clicked. That wasn't something I'd thought about in my residency training, and I've truly taken that on. And I think it makes a big difference with our patient care when we take the time as clinicians to listen to them and formulate a plan that maybe isn't textbook, but works the best for them.
The most important part of a fellowship program is learning how to address different problems. And the advantage of having multiple attendings that you're able to work with is you're going to see different ways of attacking the same problem, how they think about it, how they break it down. Because at the end of the day, you want to leave fellowship with the knowledge of how to address problems, even if you've never seen them before. You want to know how to break it down, how to process it into a solution. And by seeing and working with different people and seeing how they process the data to come up with their own unique solution that then works for them, you'll be able to take all these different experiences and then formulate your own way of thinking that in the future will aid you in your practice. And out of fellowship, I think that's the most important thing. It's just learning how to think, how to dissect the problem, and then how to take that information and turn it into a solution.
What separates our foot and ankle program from other programs is the focus on the fellows' needs to get them to where they need to be. Our fellowship, rather than being focused on using the fellows to get work done or to move patients through, is really focused on training the fellow both surgically and clinically to make them the best doctor they can be as well as surgeon they can be. And so our focus is on that, and that's what makes this fellowship great.
As a group, we really stick together, not least because we really like each other and because we have a shared set of values, a shared set of goals. And those goals are to do the very best for the patients, to put our patients first, to advance the field, to teach every day, and to find new things in foot and ankle surgery to help our patients. And not just to help our patients, but to help all patients. Because when you do research, as I've done lifelong, and you discover new things, those advances benefit people that you don't know, far away, all over other countries, all over the world. That's the idea. And everyone in our group has that idea, that we have a mission, we have a purpose. We're out to make a difference. And it's not just about making a living in any way.
I think that there's probably two things that excite me the most about what we do. One is the complexity and the variety of the things that we see. We're a tertiary referral center. We see a lot of simple problems, but a lot of really complex things, a lot of revision surgery, a lot of patients that come in with pretty debilitating issues, be it from trauma or other surgeries they've had. And I think we get to have a real impact in improving their quality of life. No 2 days are the same. It feels like, there's some bread and butter of what we do, but then quite a bit of what we take care of is pretty much as complicated as it gets with foot and ankle.
What I look forward to in a future foot and ankle fellow is a general level of curiosity and a desire and drive to be better, because not only does that drive me to learn new things, but it also drives me to be better. And then we can learn from each other, and ultimately the patient gets the best benefit because we strive to be the best we can to give them the best improvement in quality of function and quality of life improvement.
Our Foot and Ankle Fellowship Program faculty view the training of future generations of orthopedic foot and ankle surgeons as our responsibility. We take pride in our program, and we've got former fellows who are now working all over the world. Some of them are in private practice, others in academics. Some perform groundbreaking research, and others are leaders in foot and ankle societies at the national and international levels. We couldn't be prouder of the program we've built and continue to grow.